If we know what causes the subluxation, nerve interference, symptoms, and disease, then we can slow it down, stop it, reverse it, or even prevent it. It's not always easy, but it's really simple. It boils down to 3 T's: trauma, toxicity, and thought. To put it another way, trauma is structural, or what you do, or what you don't do. Toxicity is chemical, or what you ingest. And thought is mental stress, or what you perceive. Hi, this is Dr. Hobbs, restoring hope and health for lifetime family wellness. So let's dig a little deeper so that we can get to the cause or the root of what's causing the subluxation. First, mental stress causes subluxation through the muscle tension that mental stress causes. The tense muscles pull the joints and irritate the nerves, feeding those irritating signals back into the central nervous system, right? And then the brain reacts by locking down the joint segments to prevent further irritation. We don't often feel that as much as the muscle tension. We feel the restricted motion. Or even worse, it may alter signals to the brain in a way that prevents the brain from properly regulating muscle tension, blood flow, and organ function. This often leads to more dysfunction in your body. Next, physical stress causes subluxation through muscle and joint strain of accidents and injuries, but also through postural strain of sitting too much or being in unnatural positions too long, often on devices or watching shows. So then it can lead to that same cascade of problems that came from mental stress. Many of our patients had their first subluxation caused by the physical stress of the birth process. Yes, we treat pregnant mothers to help with pregnancy and delivery, but I'm also talking about babies. That's why you'll see lots of kids in our clinic. It's important to have babies and kids get their spines and nervous system checked early and regularly to keep their bodies working well. And finally, chemical stress causes subluxation through deficiencies, gut health problems, and food sensitivities that cause inflammation and muscles of the muscles, joints, and brain and nerves themselves. Inflammation is neurotoxic and promotes neurodegeneration. That means that what you eat, drink, and breathe, as well as your gut health, largely determine your prognosis with dementia, Alzheimer's, Parkinson's, and multiple sclerosis. But for the early stages, chemical stress can lead to the spinal subluxation by causing sensitivity to muscles and nerves, leading to joint dysfunction and fixation, which then further leads to nerve interference. Okay, that was some pretty heavy stuff today. What is important to remember and what can you apply? Well, remember, first, recall that the subluxation or subluxation complex is just a fancy term that means joint dysfunction that causes nerve interference. Next, subluxation is caused by mental, physical, and chemical stress. Finally, our lives are unnaturally stressful and stress-filled, beginning at birth or chemically even before birth. And what should you apply? Well, reduce bad stress, okay? Or balance bad stress that you can't eliminate with good stress. And get your spine and nervous system checked. I'll talk to you more on those later, starting in the very next video. Now, if you'd like more videos in this series called 12 Things Every Patient Should Know, text the keyword 12 things. That's the number 12 and the word things with no spaces in between to our office phone number. And you'll receive the videos straight to your device. Otherwise, give us a call. If you're not a patient, you'd like to make an appointment, we'd love to help you out. So have a wonderful day, and may God bless you.